Do you have low back pain that's not going away? In this video, I'm going to give you the 7 reasons your low back pain is not going away. My name is Dr. Nick from Preferred Physical Therapy, where we help people 40 plus stay active and independent, live free from painkillers, and avoid surgery. And I get this question often, particularly emailed to me from people on the internet, because they've been suffering with low back pain for so long and they're wondering why it's not going away. And these are the 7 most common reasons I've found in my practice as to why back pain is not going away. The number 1 reason why low back pain doesn't go away is because of a misdiagnosis. So many times we get people who come in because they've been doing all the exercises, they've been doing things for low back pain, but what they don't have is an accurate diagnosis. And without an accurate diagnosis, you can't perform the right treatment. The second reason your low back pain is not going away is because the treatment you're getting is not right for you. So it's the other half of the first one, meaning that you have to have the right diagnosis and you have to be doing the right treatment for that diagnosis in order for it to go away. The third reason your low back pain is not going away is because of posture or ergonomics. And I know this can get controversial because a lot of people think that posture ergonomics don't have anything to do with joint pain because of some recent studies that have come out suggesting otherwise. The reality is, and you can test this on yourself, if you sit in one position for too long, what ends up happening? Joints begin to get achy, things get sore. So it's reasonable to suggest that if you continue to be in those postures, those positions for long periods of time, not just minutes or hours in a day, but think minutes and hours in a day over weeks and months and years at a time, what's reasonable to expect to happen? You're going to get some joint ache, you're going to get some things that occur, what we call adaptations. These are physiologic or anatomical adaptations to your body that can contribute to your low back pain. A lot of that is weakening of muscles, changes to joint surfaces and joint mobility that then contribute to more and longer lasting back pain in spite of the treatment that you're doing. So ergonomics and posture do play a part in pain, particularly chronic and long-term pain. The fourth reason your low back pain is not going away is a lack of exercise or activity. And I know this also is controversial, particularly for people who don't have time to do exercise or don't have time to be active. And the reality is our bodies were designed and crave movement. We have to find it. We have to build it into our day. And we see this all the time in people who retire. 5 months later, they come in and see me and say, everything fell apart when I retired. And that's because just getting up for your day, going through your everyday activities, getting up, getting in the car, getting dressed, showering, walking to the office, all these activities are built into your everyday routine. And when we take those away, we notice joints break down. So this happens even if you're a desk jockey at work, 9 to 5, going to the desk, we have to find a way to build into activity. So whether that's you drink more water so that you have to take more bathroom breaks, whether that's doing things intentionally to build in activity, it's an absolute must to combat low back pain. Another way to build in more activity to your day is to park further away from wherever you're going, to church, to the grocery store, to work, wherever it might be. A way to build in more steps to your day. The 5th reason your low back pain is not going away is from psychological factors or mental stress. Mental fatigue, anxiety, external stressors that we hold in emotionally contributes to physical pain. It's been widely researched, and one of the major reasons why pain is multifactorial and very hard to measure objectively is because of how subjective it is. You might notice your physical pain goes up when you have deadlines at work to meet, family constraints, things going on around you that you feel you're losing control of, and these things are very real. One book I recommend that you read is called The Body Keeps the Score. I'll have a link in the description below to that book. Another great resource is talking to any mental health professional. There are lots of resources available online to help navigate these challenging circumstances. The 6th reason your low back pain is not going away are lifestyle choices, whether that's smoking, obesity, foods that we eat. We can even have food sensitivities. There are a lot of factors that contribute to your physical pain based on lifestyle choices. And so take an inventory that might be contributing to your low back pain in your daily habits. So consider talking to a nutritionist, talking to a lifestyle or health coach, or even your doctor about quitting smoking or making changes to your diet, medications, things of that nature. The 7th reason that your low back pain is not going away is inadequate rest or recovery. It's incredible paramount, no matter what age we are, that we get enough sleep. And often we don't get enough sleep. Too many times I've heard people tell me, oh, they get their usual 5 hours of sleep, maybe even 6 hours of sleep. We have a lot of busy moms moms and busy fathers out there, people who are doing a lot of things, wearing a lot of hats. And I totally understand. When you're feeling your low back pain get worse, check in on your rest. Check in on how many hours of sleep are you getting? How restful is your sleep? What is your sleep hygiene? Are you turning off electronics within an hour of going to bed? Are you turning off all the lights? Are you using your bed only for sleeping in terms of not taking work into the bedroom, not doing things that are going to distract you from the whole purpose of getting into bed at nighttime is to go to sleep and to rest, and establishing a good nighttime routine so you can get restful sleep. The recommendation is between 6 and 8 hours with a number of factors in between there, but just know less than 6 hours is not adequate. One thing I hear a lot of people talk about when their back is hurting is how difficult it is to get restful sleep. I totally understand that. We do have a video on some of the best sleeping positions to get into when you do have back pain. And then if that is the case where you're having a harder time getting rest, it might be that you have to schedule, that you have to be more intentional about your nighttime routine and giving yourself even a little bit more time at night to get rest, because it could be that you're not going to get a consistent 3 to 4 hours of restful sleep. So it might be that you have to get more sleep, though lesser quality, but get more sleep just to try and get on top of that inadequate sleep. At the end of the day, if your low back pain is not getting better or worsening, contact your healthcare provider. It's hugely important that we get an accurate diagnosis for your condition so that we can more accurately prescribe the right treatment for your low back pain condition. If you're looking to a solution for episodic low back pain, the kind of back pain that comes on aggressively for 2 to 3 days, and maybe you're in bed rest for a few days, and then it aches for 3 to 5 weeks, I put together a course that's easy for you to do at home. The link for that course will be in the description below.